Hey everyone, welcome back to the Happy Flosser podcast. This podcast is designed to help you feel grounded, confident, and supported while you move through dental hygiene school and into the profession. My name is Billie, and today we are going to lay down some of the foundational bricks, the kind that make everything else in your educational journey feel a little bit more manageable. I sit sometimes when I am thinking about what do I want to record next? What do I want my students to hear about? What am I seeing on socials that students are stressed about or feeling anxious about or maybe a little bit overwhelmed? And I decided to do this podcast episode specifically because I see a lot of students getting their acceptance letter and they don't really know what to do next while they're waiting for school to start. So I noticed that they start to get a little anxious and overwhelmed. So I thought I would publish this episode to help the students out there that receive their acceptance letter, or maybe you're about to start dental hygiene school, and what can you do right now? And I know I published, 10 things you can do right now last week. This one is a little bit more educational. So we're talking about dental terminology, tooth designation systems, and what it really means to be part of the dental hygiene profession in this episode. These really are the basics that show up everywhere in radiology, in your perio charting, when you're trying to do restorative, when you're in the preclinics, even how you communicate with patients and other students and faculty. So mastering these things early gives you a little sense of clarity and a little bit of control. It will keep your mind a little busy so you don't start feeling overwhelmed or maybe start having imposter syndrome right out of the gate. This will give you something tangible that you can do. So let's start with terminology. Dental language is like learning a whole new dialect. So once you understand the roots, everything else becomes easier. And I have an entire podcast on dental terminology. I think it's episode 11. It's one of my highest listened to episodes. So I know that students know this is where I need to start because it's really one of my most popular episodes students go to. And it gives you kind of the soup to nuts details about how to speak this language and how to learn how to speak in dental terms. So there's directional terms. So if I had to sift through and say, okay, what are some of the things that students really struggle with at the beginning? And here's the other piece, guys. When you first start, there's dental assisting students that are in your class, and they may already be familiar with some of these terms. So being familiar with some of these terms is huge because you're not going to feel so behind from some of the dental assisting students that are in your class. And this is really the one area where your dental assisting friends have a leg up because they've been speaking the dental terminology. So getting yourself familiar with these terms will go a long way at helping you stay in the game at the first start. So the directional terms, there's six of them. Mesial is toward the midline. Distal is away from the midline. Buccal is the cheek side of the posterior teeth. Labial is the lip side of anterior teeth. Lingual is the tongue side, and occlusal is the chewing surfaces of posterior teeth. You would call that incisal, the biting edge of anterior teeth. Those are the directional terms. So if you were to divide the body in half like you do in A and P, right? The midline of the body, anything that goes toward that midline is mesial. Anything that goes away from that midline is distal. And then there's these weird little things, right? The buccal side of the tooth is the cheek side of the posterior tooth. So the cheek side of an anterior tooth, there aren't any cheeks, so you have to use labial, right? That's the lip side of the anterior teeth. And then there's this alternative word, and this is what gets students all discombobbled at first. Facial can be used on any of those buccal or labial surfaces. So anyway, those are your directional terms. I tell students to take a little box, make a little cube, a little tooth cube, and label the different surfaces, and then actually make that little box and use that box so that, or take a little tooth, like I have this tooth here, if any of you are watching on video, and you can actually labial the mesial, the distal, the buccal, the lingual, and the occlusal surfaces, and then hold that up, how it orients in the mouth so that you can understand that mesial is toward the midline and distal is away from the midline. These terms, knowing these terms really well before you start, will go a long way at helping you feel like you're in the know the first week, because these are things that will be discussed the very first week of school. So Milbo is the way I like to, have like a little memory trick. Mesial, incisal, lingual, buccal, occlusal. That's usually the order that you'll see these surfaces listed. And you do have to know like the rules of nomenclature, how they're put together. So mesial is the boss. Whenever you have the mesial surface included in anything, mesial comes first. That's really all you need to know right now before you get started. Don't get yourself too overwhelmed. And I really wanted to make sure that this episode was not too intense for you. I want you to be able to listen to it and say, oh, I can definitely learn these things before I get started if I put some time into it. So now let's talk about anatomical landmarks, because you're pretty much going to start either in your preclinical or in your dental anatomy classes needing to hear and know those anatomical landmarks. So the CEJ is the cemento-enamel junction. It's literally where the enamel of the crown meets the cementum of the root. So the crown of the tooth is covered with enamel, the root of the tooth is covered with cementum, and that junction where those two anatomical features meet is called the cemento-enamel junction. And you are going to hear this term over and over and over. I just went over this in one of my TikTok lives with students. It was a really engaging conversation, and I could tell that this is what students need to be hearing right now that are looking to start the program sometime this year, either this summer or this fall. They're looking for these anatomical landmarks. Let's get a head start. Let's get reviewing these things. So that's why this is here. Cusp is just a pointed elevation on a posterior tooth. So as you go from the midline, right, the center part of the smile, and you work distally, when you get to the canine is the first tooth that has a cusp tip. That is just a pointed elevation on a posterior tooth. So cusp, right, it starts at the canine and works its way backward. There's lots of cusps on the premolars and molars. A fossa, now think about anatomy and physiology. A fossa is just a shallow depression. And you can open up your own mouth and take a look at the biting surfaces of your back teeth and see that there are some fossa located there. And you'll learn all of those in school. There are also landmarks called marginal ridges. Marginal ridges are borders on the occlusal or lingual surfaces. Okay, these are marginal ridges. And you'll see marginal ridges, so a mesial marginal ridge would be on the mesial part of the occlusal table, and a distal marginal ridge would be on the distal part of the occlusal table. So there's a boundary on the occlusal table that goes all the way around the tooth, and you will learn each component that makes up that boundary. And then another anatomical landmark, which you are very familiar with, that maybe you haven't put the dots together, is called the contact area. And this is where teeth touch their neighboring tooth. This is where you get the resistance when you try to floss your teeth. This is called a contact area. In your learning, you will learn all about the proper form and function of the entire dentition and how all of the different tooth types work together to perform the tasks that we ask our teeth to perform. So these terms matter because they show up in things like charting, faculty feedback, patient education. And when you can describe what you're seeing with precision in your clinical notes and to your patients, you instantly sound more confident and competent because you are when you can speak the language. It's just like anything else. The quality of our life is equally attributed to the quality of our communication. I had a good friend who told me that years ago, and it has been proven to be true time and time again for me. So let's talk about some of the clinical terminology that you're going to hear about when you start your educational journey. So plaque biofilm, it's not gunk, it's not stuff, but it's a structured community of bacteria. And you are going to get to know the components and the mechanisms of action for plaque biofilm on a microscopic level that really helps you show up as the best clinician for your patients to help them understand how they can be preventing caries and periodontal disease at home. Plaque biofilm it's really important for you to understand that plaque biofilm is literally a community of pathogens, and how that all functions shows up in the mouth as our caries risk when we see the disease process happening. So that is a clinical term that you will get to know very well, as well as the entire life cycle, process, and development of plaque biofilm. Calculus is simply mineralized plaque, and you will certainly become attuned to calculus, both calculus detection and calculus removal. I want you to think of calculus like the little barnacles that build up. If you've ever been out on a boat out at sea or seen somebody pull something out of the ocean, there's all these like barnacles that are built up and you have to get the barnacles off. I think of calculus obviously much smaller in that way. Calculus is simply mineralized plaque that's hardened onto the tooth surface, and we remove it for our patients. We know that it's not only a chemical, but a physical irritant to the tissue healing. Another term that you will hear right when you get started is debridement. Debridement is simply defined as the removal of deposits, whether that is soft or hard deposits. So you could be debriding the root surface to remove plaque biofilm or calculus. There might be a time where you're learning about your different strokes and you will hear the word debridement. Prophylaxis is a word used to describe the preventive cleaning that is performed on healthy patients only. Prophylaxis. And, our patients don't really know the name prophylaxis, but it is a term that we use to communicate with the insurance companies on what services we are providing our patients. And then periodontitis think about what that term means. Itis is inflammation. Perio means the attachment around the tooth. Periodont, dont is tooth. So perio is around the tooth, inflammation. So inflammation and attachment loss of the surrounding tissues around the tooth. That is the simple way to understand periodontitis. You are going to learn all there is to know about periodontitis. Students often tell me, I know what I'm looking at, but I don't know the right words to describe what I'm looking at. This is the bridge, guys. The more you use the language, the more fluent you become. And you will get to the point where you've learned all these terms, and now you can't use them when you're talking to your patient. You have to switch it off. You'll use them when you're talking to fellow providers, your faculty, the dentist, or when you're talking to a patient. If you start using these terms, you have to remember that right where you are right now before you learn these terms is where your patient is. So there are some times when you want to use these terms for the notes, but when you're talking directly to your patient and educating your patient, you want to make sure that the terms are not putting a barrier between what you're trying to convey for information and what they are understanding that you're saying. So that is a really tricky thing. First, you learn all this language, and then you can't use it when you're trying to describe something that you know the word to use for your patient, because your patient doesn't know. So right now where you are is where your patient usually shows up. So try to keep that in mind when you start learning these clinical terms. Okay, let's switch gears and start talking about tooth designation systems. So tooth designation systems, incredibly important. There are 3 systems and this can be really overwhelming at first until it clicks. There are 3 systems that you are required to learn as a dental hygienist. The universal numbering system, which is our standard system in the United States, the Palmer notation system, which is used in the military and ortho offices, and the FDI International Standard System, which is used universally throughout the globe outside of the United States. All right, so simply put, the permanent teeth, there's 32 of them. They go from 1 to 32. If you start in the upper rightmost posterior tooth, the wisdom tooth is number 1. which would mean the canine in the upper right is number 6, the canine in the upper left is number 11, and the wisdom tooth in the upper left is number 16. You go down to the lower left, the wisdom tooth is number 17, the canine is 22, the other canine on the lower right quadrant is 27, and the wisdom tooth on the lower right is 32. If you can learn all of the tooth numbers in between, I only listed those because I want to make sure my episode doesn't get too long. That will help you if you can quiz yourself on all the tooth numbers of the universal system. So many students take too long to learn and memorize these. You've just got to do it. When you get to the primary teeth in the universal numbering system is letters, capital letters going from A to T. So the upper rightmost posterior molar is A. The upper leftmost posterior molar is J. The lower leftmost posterior molar is K, and the lower rightmost posterior molar is T. So AJ and KD are friends. There's all these different ways that you can memorize this. I do believe I have an entire tooth designation system episode. I think it's episode 14 or 15 in my podcast history. So if you want more detailed discussion about each one of these systems, definitely go check that out. The Palmer notation system, if you just think of the midline dividing the mouth left and right, and then the occlusal plane dividing the mouth from maxillary and mandibular, there is a bracket that we use to denote which quadrant you're in. For the maxillary and mandibular permanent dentition, we use numbers. All the centrals are 1, all the laterals are 2s, all the canines are 3s, all the first premolars are 4s, and so on, all the way to number 8. For the primary dentition, we still use the same bracket to denote which quadrant you are in, but we use letters, just like the universal numbering system. All the central incisors are A's, all the lateral incisors are B's, all the canines are C's, all the first molars are D's, all the second molars are E's. So that is your Palmer notation system. Now, when we get to the FDI system, it's a 2-digit system. So the first digit denotes the dentition, arch, and quadrant. And the second digit denotes the tooth, where it's positioned according to the midline, kind of like Palmer. There are no letters in the international system. So that first digit, if it's 1 through 4, the 1 would be the upper right quadrant in the permanent dentition. The 2 would be the upper left quadrant in the permanent dentition. The 3 would be the lower left quadrant in the permanent dentition. And the 4 would be the lower right quadrant in the permanent dentition. So that first digit tells you the dentition, arch, and quadrant that you are in. The second digit tells you which tooth it is. Central incisors are 1s, laterals are 2s, canines are 3s, and so on. So for example, 22 would be quadrant 2 of the permanent dentition, and it's the lateral incisor. So it is the permanent maxillary left lateral incisor. Okay? Those are your 3 systems. So you'll see these 3 systems in the textbooks, the board exams, and in the clinical setting. Being bilingual or trilingual with numbering systems makes you really adaptable and confident, because when you are on places like TikTok or conversing with specialty offices, they are going to use different systems, especially ortho, and you got to be able to switch your brain so that you know that you're communicating with them about the correct tooth. So the last thing I just want to touch on is the profession of dental hygiene itself. Let's just zoom out a little bit and talk about the profession that you are stepping into. Dental hygiene is not cleaning teeth, right? I like to call us dental nurses. It is a preventive, evidence-based, patient-centered healthcare profession. It's grounded in scientific research. We do the ADPI model as our backbone: assessment, diagnosis, planning, implementation, evaluation, and documentation. Your role in all of these things is not tooth cleaner. If that's what you've signed up for, you're in the wrong profession. You are a clinician. You are an educator. You are a patient advocate. You are a profession advocate. You are a solid communicator who lifts up patients' understanding of what is going on in their mouth. You are a critical thinker. You are a lifelong learner. You are a collaborator within the healthcare team, both inside your office and outside your office. Think about what your impact is. You reduce disease burden. You improve systemic health by managing oral health issues. You empower patients to take control of their well-being, and you build trust and safe environments in the dental office. That is huge. And guys, you do all of this while navigating school, expectations, critical feedback, and your own personal growth journey. This deserves recognition, and I'm giving that to you right now. It is huge what you're about to encounter in dental hygiene school. You become a dental provider. You really do. You are not there, but you will be. And you have to make that commitment, and you will transform into this person. So as you move through your courses and your clinical sessions, remember this. These foundational concepts are not meant to overwhelm you. They're meant to give you that structure, a little framework that supports everything else that you're about to learn. You don't have to memorize everything at once. You just have to keep showing up, keep practicing the language, give yourself a little permission to learn at a human pace. You are building a professional identity. Okay, you're doing this one assignment, 1 week, one term, one tooth, and one patient at a time. If today's episode helped you feel a little more grounded, share it with a classmate who might need to see the same boost. And if you want more episodes like this, I'm here to support you every step of the way. If you are a new dental hygiene student, I have built up a limited series podcast. It's 6 episodes. Oh my goodness. It's called The Dental Hygiene Student Starting Strong. It is 6 limited series episodes. Go check that out, okay? And I just want you to know I am very proud of you for getting accepted into the program. I am here for you, and I will be here for you every step of the way. Make it a good week, guys.